Difficulties with using a toilet, accidents and incontinence can all be problems for people with dementia, particularly as the condition progresses. These problems can be upsetting for the person and those around them. Hello, I'm Hannah, and in the second episode of this two-part podcast, I speak to Helpline Supervisor Sian about dealing with incontinence and how the changing dynamics can affect carers. What are some of the first signs of incontinence?
Well, people can get very embarrassed about continence problems, so they may not want to mention them because of taboo around the subject, and also depending on the abilities of the person with dementia, they may not be able to recognise the problem or communicate it. So it's often the case that carers notice clues rather than the person with dementia raising any worries directly. Because different people experience dementia symptoms differently, depending on the type of dementia and the area of the brain that's being affected, and also any other health or mobility problems they may have, there are lots of different ways that you may start to notice problems with incontinence. Sometimes the first hints may be that the person's changing clothes or bedding frequently, maybe even hiding or throwing away the dirty clothes or bedding. This may indicate either that they're not recognising the need to go to the toilet or that they aren't getting there in time. If the person's reluctant to wash and change clothes, the clues might be in the deterioration in their personal hygiene. Sometimes the person is able to use the toilet but has difficulty remembering what to do, so you may discover attempts to clean up, like soiled cloths or towels. Sometimes if the person becomes confused, they may go to the toilet somewhere inappropriate, like a wastepaper basket or in the corner of a room. And some people with dementia may even be reluctant to drink so as to stop themselves from needing the toilet.
How should you broach the subject with a person with dementia?
Think about how the person tends to react to difficult situations. If they are embarrassed or distressed, do they prefer matter-of-fact language, or do they prefer a very gentle approach with lots of reassurance? People can be really sensitive if they're challenged about having accidents or forgetting their toilet habits, and they may not remember it having happened. It can help the carer to remember that this is a symptom of the dementia and not something that the person's doing deliberately. It's usually best not to point out to the person that they've done something wrong, as it might sound like criticism or judgment, and that can lead to distress on both sides, and it's unlikely to be remembered for the next time.
What can you do to help someone who might need assistance going to the toilet?
Well, it very much depends on the person and their abilities as to what help is most appropriate and most likely to be accepted. It may be helpful to check at regular intervals whether the person needs the toilet. If someone's very defensive about their abilities, you might need to be very tactful about how you offer support. You may be able to prompt from outside the toilet, or they may need you to be in the room talking them through the steps or physically guiding them. If the person has restricted mobility, they may not be able to get to the toilet or change bedding or clothes easily, and so it's important to react quickly to keep them from suffering skin problems and discomfort from contact with soiled areas. If it's not always possible to get to the toilet in time, especially at night, continence pads or pull-up pants may become necessary. You can ask the GP for a referral to a continence advisor or a community nurse who can talk to you about the most appropriate products and also about eligibility criteria in your area. If you're going out, it can help to plan ahead, taking a change of clothes and spare incontinence products. Think about where you might be able to stop for toilet breaks on the way and while you're there. You could get a Just Can't Wait card from the Bladder and Bowel Foundation, and this will sometimes get you into toilets in shops that customers may not usually have access to. You could also buy a radar key, which allows access to thousands of locked toilets around the country.
Are there any changes that you should make to the environment?
Well, it's important to remember that people with less advanced dementia may not be fully incontinent. They may just have difficulty with the practical steps involved in using the toilet. So these days a lot of bathroom suites are all white, so there's very little visual contrast between the toilet lid, the seat and the bowl, and if the walls and floor are also of a similar colour, it may be that they can't see the toilet properly or find the toilet paper, either through poor eyesight or problems with perception that can be caused by dementia. It might be worth trying a different coloured toilet seat and maybe a contrast between the wall and the toilet paper. You could look at whether the lighting is sufficient, because older people need more light to see by than younger people. And signage can be helpful in the bathroom itself, showing the person what to do, but also as a way of directing them into the correct room. You might try words or pictures or both. If people have mobility problems, they may be able to use a commode kept close to where they spend most of their time. This is dependent on them being able to understand what it's for and being willing to use it, as it may be less private than the bathroom, so it's most likely to be effective for someone in the early stages of dementia.
What are the best types of clothing for a person who needs help with personal care?
Well, choice of clothes can be a really good way to help a person with dementia to keep control over their own personal care as much as possible, especially if they have poor eyesight or coordination problems. Velcro or elastic can be easier to manage than laces, zips or buttons, which can be really fiddly. If the person's able to remove their own clothes easily, they may be more likely to make it to the toilet in time, and they may find it easier to change their clothes for clean ones.
What issues do people most commonly have around the changing dynamics with personal care?
Well, helping or accepting help with personal care can feel uncomfortable. For many people, personal care will be given by a partner, a husband or wife, or a grown-up daughter or son. And this means that the usual forms of physical contact may change considerably, which can be difficult both for the person with dementia and the carer to come to terms with. And where children are caring for parents, there can be a feeling of role reversal.
And do you have any tips on the best ways to deal with these sort of feelings?
Well, providing personal care is by no means always a negative experience. Many carers talk of feeling a sense of privilege in taking their turn to care for someone who's loved and cared for them over many years. They're often able to follow a routine and increase support gradually as it's needed. Acknowledging awkwardness and using humour and calm reassurance, as well as keeping a flexible attitude, helps a lot of people to navigate the difficulties. It's also important to recognise that providing personal care can be challenging, and sometimes carers need help, either from other members of the family or by accessing social care support privately or through social services. And as well as practical support, carers and people with dementia can sometimes benefit from emotional support.
For more information, please visit alzheimers.org.uk or call the National Dementia Helpline on 0300 222 1122. Thank you for listening to the Alzheimer's Society podcast.